Every year, over 800,000 people in the United States alone suffer a heart attack, and the numbers continue to rise worldwide. While factors like poor diet, lack of exercise, and chronic stress can all play a role in cardiovascular disease, many people don't realize that some of the medications they take on a regular basis may significantly increase their risk of a heart attack. From over-the-counter painkillers to prescription antidepressants and beyond, several widely used drugs have been linked by research to elevated risks for serious heart-related complications. In this comprehensive guide, we'll reveal 8 medications supported by scientific findings that could be silently harming your heart without you realizing it. We'll also discuss practical strategies for reducing these risks, exploring safer alternatives, and knowing when to talk to your doctor about potential changes. By the end, you'll have a clearer understanding of how to protect yourself from medication-related heart dangers and stay proactive about your cardiovascular health. NSAIDs, the painkillers with a hidden price. What are NSAIDs? Non-steroidal anti-inflammatory drugs known as NSAIDs include widely recognized names such as ibuprofen like Advil and Motrin, and naproxen like Aleve. Millions of people turn to them for relief from pain, inflammation, and fever. However, mounting evidence suggests that both short-term and long-term use of NSAIDs may substantially increase the likelihood of heart attacks and strokes. Scientific evidence. A 2017 study published in the British Medical Journal found that taking NSAIDs for as short as 1 week could raise heart attack risk by 20 to 50%, varying based on the dosage. Researchers attribute this outcome to the drug's capacity for influencing prostaglandins, hormone-like substances that help regulate blood vessel function. Through fluid retention, arterial constriction, and heightened blood pressure, NSAIDs can force the heart to work harder, thereby contributing to the formation of clots that precipitate heart attacks or strokes. Who's at greatest risk? Individuals with established heart conditions, uncontrolled high blood pressure, or a prior history of heart disease face the highest vulnerabilities. Even people without these issues should proceed cautiously, particularly if they frequently rely on NSAIDs for pain management. In some instances, an increased reliance on these medications can prompt dangerous levels of cardiovascular strain. Safer strategies. To minimize risks, use the smallest effective dose for the shortest period possible. If you need ongoing pain relief, explore alternatives like acetaminophen, also known as Tylenol, or natural anti-inflammatory substances such as turmeric and ginger. Consulting a healthcare professional can help in determining whether physical therapy, targeted exercises, or alternative medications might be suitable if NSAIDs prove problematic over the long term. Antidepressants, potential hazards to the heart, medication categories. 2 major categories frequently prescribed for depression and anxiety include selective serotonin reuptake inhibitors, or SSRIs, like fluoxetine, also known as Prozac, sertraline, known as Zoloft, and escitalopram, which is Lexapro, and serotonin norepinephrine reuptake inhibitors or SNRIs such as venlafaxine, known as Effexor, and duloxetine, also called Cymbalta. While they can significantly improve mood disorders, these drugs can introduce certain cardiovascular risks. What the research says. A 2018 study in JAMA Psychiatry suggested that SSRIs in particular might slightly raise the risk of heart rhythm complications and stroke in vulnerable populations. Additionally, some antidepressants can affect platelet aggregation, decreasing the blood's ability to clot properly and inadvertently raising the chances of bleeding-related events such as hemorrhagic stroke. People with uncontrolled high blood pressure, existing cardiovascular conditions, or a background of arrhythmias may be more susceptible to these potential problems. Making informed choices. For many individuals, the mental health benefits of antidepressants surpass the associated risks, but monitoring is essential. If you have heart concerns or a family history of cardiovascular disease, talk to your healthcare provider about a thorough evaluation. They might recommend additional heart function tests or suggest alternate treatments like cognitive behavioral therapy, structured exercise regimens, or dietary changes. Abruptly, stopping antidepressants is never advisable. Always follow a medically guided tapering plan to avoid withdrawal symptoms. Calcium channel blockers such as amlodipine, diltiazem, and verapamil are regularly prescribed to reduce high blood pressure, alleviate chest pain, and manage specific heart rhythm disorders. They function by relaxing blood vessels, which eases the heart's workload and contributes to lower blood pressure. Despite these benefits, certain calcium channel blockers have been linked to increased risks of heart failure and heart attacks. According to a study published in Circulation, short-acting calcium channel blockers can raise the likelihood of heart attack by about 25%. Although long-acting forms tend to be safer, caution is advisable, particularly in individuals already managing heart disease or poorly regulated blood pressure. These drugs can trigger fluid retention, aggravating heart failure in susceptible individuals. Precautions and possible alternatives. Consult your doctor if you notice symptoms like dizziness, irregular heartbeats, or swelling in the legs and ankles while on calcium channel blockers. Other medication classes, including ACE inhibitors and beta blockers, might be better for some patients. Your healthcare provider can help tailor a regimen that balances the need for blood pressure control with minimizing adverse heart effects. Diabetes medications, when controlling blood sugar threatens heart health. Several medications designed to help control type 2 diabetes come with increased heart attack risks. Notably, thiazolidinediones or TZDs, such as rosiglitazone, also known as Avandia, have been at the center of controversy. A New England Journal of Medicine study from 2007 found that rosiglitazone was linked to a 43% higher risk of heart attacks, along with a 64% jump in cardiovascular death. Mechanism of harm. TZDs can encourage fluid retention, increasing blood pressure and placing extra strain on the heart. Consequently, this can worsen heart failure or escalate the chances of cardiac events in people already at higher risk. Safeguarding your heart. If you're on rosiglitazone or a similar diabetes medication, discuss the possibility of switching to safer alternatives like metformin, SGLT2 inhibitors, or GLP-1 receptor agonists. Focus on lifestyle strategies such as a balanced diet, regular exercise, and weight management that not only control blood sugar but also lower cardiovascular stress. Decongestants quick relief with long-term consequences. When you have a cold or sinus congestion, you might reach for over-the-counter medications containing pseudoephedrine, like Sudafed or phenylephrine. While these decongestants can momentarily relieve nasal blockage, they can also raise your heart rate and blood pressure. A study featured in the American Journal of Medicine found that using pseudoephedrine could notably increase the risk of heart attacks in those with hypertension or other cardiac problems. By constricting blood vessels to decrease sinus swelling, these drugs inadvertently impose additional strain on the cardiovascular system, making them risky for anyone already prone to heart conditions. If you have pre-existing heart disease or high blood pressure, it may be wise to avoid these decongestants. Instead, try options like saline nasal sprays, steam inhalation, or antihistamines if allergies are also at play. Always double-check product labels and consider consulting a pharmacist or healthcare provider before using any new over-the-counter medication. Chemotherapy agents can be lifesavers for cancer patients, but certain ones have a notorious reputation for harming the heart. Anthracyclines like doxorubicin, also known as adriamycin, and drugs such as 5-fluorouracil or 5-FU are prime examples. In JACC Cardio-Oncology, studies indicate that doxorubicin can lead to heart failure in up to 26% of patients at higher doses or prolonged regimens. These drugs produce free radicals that damage heart cells, leading to inflammation and potential scarring of cardiac tissue. Meanwhile, 5-FU can spur coronary spasms, cutting off blood flow and possibly causing a heart attack. Physicians frequently use echocardiograms or other cardiac assessments to track heart function in patients undergoing chemotherapy. Some medications, such as dexrazoxane, offer a degree of protection against heart damage. Maintaining a healthy lifestyle, incorporating antioxidants, balanced nutrition, and gentle physical activity may also be beneficial during and after cancer treatment. Testosterone and anabolic steroids, muscle gains at a cost. From prescription testosterone therapy for low hormone levels to illicit anabolic steroids used by athletes and bodybuilders, these substances can bolster muscle mass and energy levels. However, they also raise significant concerns about heart health. Scientific evidence. A 2017 study in JAMA Internal Medicine found that men newly beginning testosterone therapy experienced a 30% higher risk of heart attacks and strokes within the initial 3 months. Anabolic steroid abuse has been associated with sudden cardiac death, even in young, otherwise healthy individuals. Why the risk increases. Testosterone raises red blood cell counts, making the blood thicker and more prone to clotting. It can also reduce HDL or good cholesterol, elevate LDL or bad cholesterol, and cause the heart's walls to thicken, affecting normal cardiac function. Long-term use or misuse amplifies these dangers. Staying safe is crucial. Only pursue testosterone treatment under a doctor's supervision, ensuring regular blood tests to monitor for adverse effects. As for anabolic steroids used without medical reasons, The best approach is to avoid them entirely and concentrate on natural hormone-boosting methods like adequate sleep, strength training, and balanced nutrition. Proton pump inhibitors, or PPIs, including omeprazole, esomeprazole, and lansoprazole, are widely prescribed to address gastroesophageal reflux disease and ulcers by cutting down on stomach acid. Despite their effectiveness, extended PPI use has been tied to a heightened chance of heart attacks and overall cardiovascular harm. A Stanford University study analyzing more than 3 million patient records concluded that long-term PPI users faced a 16 to 21% higher risk of heart attacks, even if they had no prior heart disease diagnosis. Potential mechanisms include reduced nitric oxide production in blood vessels, increasing stiffness in arterial walls, and encouraging higher blood pressure. PPIs have also been linked to deficiencies in magnesium, vitamin B12, and other micronutrients. Magnesium shortages in particular can contribute to irregular heart rhythms and other cardiac complications when left unaddressed. If you require medication for chronic heartburn, consider whether an H2 blocker like ranitidine or famotidine might be adequate. Lifestyle adjustments such as weight management, elevation of the head during sleep, and dietary moderation can help reduce reflux symptoms with fewer cardiovascular drawbacks. If prolonged PPI usage is inevitable, monitoring nutrient levels and collaborating with a healthcare provider can mitigate potential risks. Your health is, ultimately, in your hands. While many of the medications listed here can be life-changing or even life-saving for countless individuals, understanding their possible drawbacks is vital for making informed decisions. If you're concerned about the impact of any drug on your heart, the best course of action is to discuss it with your doctor. Ask about alternative treatments, dosage adjustments, or additional monitoring that might safeguard you against serious complications. Never stop or alter a prescription abruptly without talking to a healthcare professional first. Keep an open dialogue with your doctor, particularly if you have existing risk factors like hypertension, high cholesterol, or a history of heart disease. Adopt a heart-healthy lifestyle, eating a balanced diet, exercising regularly, managing stress, and avoiding smoking, to reduce the likelihood of heart attacks and related issues, whether you're on medication or not. If you suspect side effects, track your symptoms in a journal and share these observations with a medical expert. Early detection of adverse reactions can prevent more severe outcomes. Ultimately, an awareness of the research linking certain commonly used medications to elevated heart attack risks puts you in a stronger position to take control of your health. By advocating for yourself, asking questions, and exploring safer alternatives where feasible, you can strike a balance between beneficial treatment and overall cardiovascular well-being. Remember, your heart is one of your most precious assets. Don't be afraid to speak up and take proactive steps to protect it. If you found this information helpful, consider sharing it with friends or family who might also benefit. Knowledge is power, and in this case, it could even be the key to saving a life.